Community engagement is an essential part of implementing a successful malaria elimination program. Let's spend some time to understand how to improve engagement of communities in malaria elimination. By the end of this unit, you should be able to describe the different attributes of communities that are stakeholders in malaria elimination, explain the different roles that communities may play in malaria elimination, identify the four community engagement approaches and provide examples of each, and explain how malaria elimination can be achieved without stigmatization. For the purposes of malaria elimination, we will define a community as a group of people who share one or more defining attributes and are connected socially according to relationships that have developed over a period of time and may be modified in the future. There are several important defining attributes that communities may share. Communities may share a geography or place. Our traditional view of communities is often a neighborhood, township, hamlet, or village. But we now understand that there may be other communities not formed by geographic proximity that are also stakeholders in malaria elimination. There may be communities formed around shared culture, values, and norms. For example, saving societies may be created around values related to saving money and spending wisely to benefit family and neighborhood. Communities may form around shared identities and interests. Many countries have mothers' unions that are communities formed by people who share identities as parents and share a strong interest in safeguarding the health of their children. We all know communities formed around professions or activities. Many of us are members of professional organizations or unions. These are communities of practice, and many such communities are engaged in malaria elimination. For example, medical associations are very important in helping to set the policies by which health workers can participate in malaria elimination activities, such as diagnosis and treatment. And then there are communities formed by circumstances, such as natural disasters or political conflict. Refugees living in a camp are a community formed by circumstances. By definition, all communities have some type of social connection. These relationships that have developed over time and are dynamic, with the potential to change. In most societies, individuals do not belong to a single, distinct community, but rather maintain membership in a range of communities based on variables such as geography, occupation, social, and leisure interests. For malaria elimination, it's important to note that stakeholder communities will include not only the people at risk of the disease, but also health professionals and policymakers. As a community, health professionals have their own skills, experiences, and perspectives, and should be meaningfully engaged in the process of planning and implementing the activities they are entrusted with. Now that we have defined different types of communities, let's discuss the roles that communities may play in malaria elimination. These roles may range from beneficiary to agent of change. First, the individuals that reside in communities affected by malaria will benefit from a successful malaria elimination program by experiencing improved health and social outcomes. Second, communities are a critical resource to the malaria elimination program. They have local knowledge and skills that can better inform activities and strategies. Communities play an important role in the malaria response and in building resilience against future disease outbreaks. Third, communities are also carers. Carers may be formal members of the healthcare system, such as doctors or nurses. Carers may also be community or volunteer health workers. And almost all community members are carers, at some time, for members of their family or neighbors when they fall ill. Communities are the guardians of health. Fourth, communities can be political power centers. Communities select their leaders and representatives and hold others to account. They can press their representatives to improve health systems and to achieve objectives such as malaria elimination. They can also communicate their priorities to officials and hold them accountable for improving their collective well-being. And finally, communities can be change agents. Grassroots communities can push or agitate for changes that are needed to better their health or situation. Participants in the Zero Malaria Starts With Me campaign are pushing political, private sector, and community leaders to accelerate malaria prevention and elimination to save lives. Let's start by saying what community engagement is not. Community engagement is not a top down, expert led effort to inform or persuade community members, as illustrated by the image on the left. While these types of interventions may bring community members in contact with the health system, such interventions often treat community members as passive recipients of messaging campaigns rather than as active participants involved in the design, implementation, and evaluation of their own health programs. Instead, community engagement is a process of developing relationships and working collaboratively with and through groups of stakeholders to address health related issues and promote well being in order to achieve positive health impact and outcomes, as illustrated on the right. Community engagement is not a program, it is a way of doing business. Community engagement for malaria elimination starts by asking about the network of important stakeholder relationships that influence all aspects of an elimination program and the achievement of a malaria free status. The next step is to determine how intentional and skilled engagement with important stakeholders can improve these outcomes. In malaria elimination, community engagement is particularly important because community uptake of interventions is likely to change as the burden of disease changes. As malaria becomes more and more rare, engagement with the community must intensify in order to maintain support for prevention, surveillance, response, and treatment activities. Community engagement is a process of developing relationships and working with and through groups of stakeholders to influence program, service, or health outcomes of interest. There are a range of approaches to community engagement. Different contexts or settings may lead to one approach being more appropriate than another. These approaches are not discrete nor mutually exclusive, and a combination of features of these approaches can be used. When using a community oriented approach, the community is informed and mobilized to participate in addressing immediate short term concerns. Strong external support is still required, often to organize logistics and to conduct a campaign. This approach is most applicable to improving intervention coverage, mass ITN distribution, and IRS campaigns often use a community oriented approach. In the community based approach, the community is consulted to improve access to health services and involved in programs by locating interventions inside the community. Some external support is still needed, such as for procurement of commodities. A community based approach helps improve access to interventions and is exemplified by the routine distribution of ITNs in health clinics and the use of community health workers to deliver seasonal malaria chemoprevention. A community managed approach involves collaboration with community leaders to enable priority settings and decisions from the people themselves. This may or may not require the external support of partners. Through consultation, the appropriateness and acceptance of the program to the community will be improved. Village or district health committees that are engaged to help inform and manage a health program are examples of this approach. A fully community owned approach occurs when assets are fully mobilized and the community is empowered to develop systems for self governance, establish and set priorities, implement interventions, and develop sustainable mechanisms for health promotion with partners and external support groups as part of a network. This approach improves community autonomy and ownership of the health program. As an example, some communities use community generated funds to conduct larval source management. Each approach is distinct, and no approach is of a higher order than another. In selecting an appropriate community engagement approach, the desired outcome should be the primary consideration. For example, in a malaria outbreak, a community oriented approach is perhaps most appropriate as the objective would be to mobilize sick people to seek care early and to fully participate in vector control campaigns. On the other hand, to design and implement a reactive drug administration program, a community managed approach would be best. Now that we have considered different types of approaches for community engagement, let's see how to design and implement a community engagement plan. As we said earlier, community engagement is a way of doing business, not a program. But there are still elements of community engagement that are similar to programs. To achieve successful community engagement, the strategy should be designed, implemented, and evaluated and then that information should be used to redesign and improve the strategy. Community engagement must be an iterative process that relies on regular involvement, frequent feedback, and active participation of the community. The first step is to design and plan the strategy. To design an appropriate community engagement strategy for malaria elimination, it is important to first be clear about the goals of the strategy and which communities will be engaged. A community engagement strategy that is unable to articulate the reasons why it is important for community members to be involved or that targets the wrong community may end up overburdening community members with unnecessary and poorly conceived engagement strategies. Once the goals are clear, then the type of approach that best suits the goals can be selected. Because malaria elimination requires local knowledge, it is best if local teams are supported to develop their own locally tailored community engagement process instead of designing one at the national level. Local teams will better understand the community structure and the interests, skills, and experience of the community members. Mapping of these relationships between stakeholders, including the flows of information, can be helpful to identify gaps between those who can plan strategies and activities and those who implement them. Similarly, gaps between those who implement strategies and activities and those who participate in or benefit from them can be identified. Recognizing these disconnects can pinpoint areas where improved collaboration could advance malaria elimination programs. A range of different stakeholders, from community leaders to health facility personnel, should be consulted early in the design process. Not only does consultation help improve the final strategy, but also the process of consultation is central to engagement and helps to unite a variety of actors around a shared vision. Involving other stakeholders might lead to a new perspective or understanding of the malaria elimination program, which could help to define the approach. Communication strategies are needed to tailor approaches to local and disease specific needs. Communication strategies should use multiple channels, including local and social media, and involve various actors to promote information and provoke dialogue. These actors could include community health workers, local and religious leaders, and school teachers. Implementation of the strategy involves going to the community, establishing relationships, building trust, working with the formal and informal leadership, and seeking commitment from community organizations and leaders to create processes for mobilizing the community. Communication strategies with the various communities being engaged must be established as bidirectional so that community feedback is received, understood, and incorporated into the community engagement process. Community members and service providers should meet regularly for mutual advocacy and to assess progress with the twofold aim of improving malaria control while empowering communities to gain mastery over their risk of disease and ensure sustainable and locally owned development. Organizations that wish to engage a community must be prepared to release control of actions or interventions to the community and be flexible enough to meet its changing needs. Appropriate collaborative and decision-making structures must be developed, such as community advisory boards or task forces. After the community engagement strategy has been implemented, it's important to periodically evaluate the level and diversity of engagement of the community. Because community engagement is an ongoing approach that requires long-term commitment by the engaging organization, it should not be considered a task to be completed, but a new way of doing business. That doesn't mean it's easy. Without maintenance and attention, it might be easy for some people to slip back into the more familiar top-down approach. Periodic assessments are one way to prevent that backsliding. Finally, we have said that community engagement is an iterative process. As a result, information received intermittently from the community through feedback mechanisms and periodically from assessments should be used to improve the level of engagement achieved. Now that we've reviewed the different types of approaches and how to develop a community engagement plan, let's envision what a community that is fully engaged in malaria elimination might look like. A community that is engaged in malaria elimination collaborates with the malaria program by co-planning, co-implementing, and co-evaluating malaria elimination activities. In this community, Mary is on the health center's community advisory board, where she provides suggestions on how to ensure the community is aware of and prepared for an upcoming indoor residual campaign. She also provides feedback on the quality of services provided by the health center, including suggestions on how to improve attendance of pregnant women at antenatal clinics. Ahmed is a youth community health promoter. He works with adolescents to ensure that they understand the need to sleep under insecticide treated nets and to seek healthcare quickly for febrile illnesses. John performed in a dance group during a recent World Malaria Day event and at the launch of the mass distribution of insecticide treated nets last year. Demona joined the discussion during a Mothers Union meeting about the benefits of malaria elimination and participated in a vote on malaria elimination, voting for elimination of malaria in her community. Amina researched the cost of malaria to her country and presented the results to the community to help them understand how malaria elimination would benefit them economically. The entire village joined in a participatory evaluation exercise after the last mass campaign for insecticide treated nets to provide feedback on how well the campaign had been conducted. Dr. Sandra participated as an advisor to a Ministry of Health task force, developing guidance on how to improve adherence to anti malaria medicines and follow up of all patients through the half life of the medication. As you can see, an engaged community is involved in co developing, co implementing, and co evaluating all aspects of the malaria elimination program. We learned in Unit 2 that malaria begins to cluster in certain geographical areas and certain populations as transmission declines. We used this understanding of malaria transmission dynamics in several of the interventions designed to reduce transmission, including targeted drug administration and reactive strategies. Malaria is not a stigmatizing disease under normal circumstances. However, stigma could arise depending on how programs are implemented and how strategies to eliminate malaria are presented. There are several ways to eliminate stigma from malaria elimination. The first is to recognize that as areas approach elimination, malaria infection becomes more concentrated in certain geographies and populations that may already be socially disadvantaged. This includes migrants, displaced persons, ethnic minorities, and poor rural communities. The fact that these populations or areas might already be disadvantaged should be recognized by the malaria elimination program. Preventing further adverse social impact on these groups should become an important consideration in the elimination program. The second is to recognize that language can frame the way that groups are perceived and ultimately lead to their stigmatization. Referring to certain groups as reservoirs of infection or hot populations labels them as the source of contagion in an area rather than vulnerable populations needing to be protected from malaria. This can lead to blaming certain groups for malaria or presenting them as a threat to elimination. Such terms are likely to cause more harm for those who are more socially disadvantaged to begin with. It's particularly important to take care with migrant or refugee populations who might already be marginalized from society. Talking about preventing malaria in high risk situations rather than high risk groups of people can shift the focus away from scapegoating certain populations. By engaging communities affected by malaria in elimination settings, including those that may be socially marginalized, malaria elimination programs can improve their understanding of local social dynamics and identify strategies to provide better services to people at risk of malaria. Finally, elimination programs should monitor the social impact of their interventions to determine if stigma is occurring to any malaria affected populations and to determine whether their efforts to eliminate stigma are working. Let's pause a bit to stop and reflect. Please form small groups of 3 to 4 people. In your group, choose at most 3 malaria elimination or control activities with which you are personally involved. The activities could be malaria diagnosis, treatment, vector control, national strategic planning, monitoring and evaluation, or seasonal malaria chemoprophylaxis campaigns, for example. After identifying up to 3 activities, your group should consider what the stakeholder communities could contribute to this activity. And finally, a brief brainstorming session. How could you engage the community more through having them serve as co planners, co implementers, or co evaluators of the activity? In summary, a community is a group of people who share one or more defining attributes and are connected socially according to relationships that have developed over a period of time and may be modified in the future. Communities may benefit from elimination, provide resources and knowledge to the effort, care for malaria patients, hold leaders to account, and initiate change. There are a range of approaches to community engagement. These approaches are not discrete or mutually exclusive, but different settings may lead to one approach being more appropriate than another. Malaria elimination can be achieved without stigmatization if programs avoid scapegoating and focus on engaging affected communities.